and get started. There we go. Thank you for setting this up, Christiana, and getting us started. And to everyone, welcome to the Drug and Alcohol Research Centre at Middlesex University. I'm Betsy Thom, one of the co-directors of the centre, along with Rachel Herring and Karen Duke. And we're very, very pleased to see people from so many different countries attending, as far away as Malaysia, the Philippines, India. It's incredible. I think this is due to the fact that we are now hosting the UK chapter of the International Society of Substance Use Professionals, and they've kindly advertised a seminar for us. Those of you who have joined us, you're welcome to become members of the UK chapter. It's open and you can find the details on the ISUP website. So now it's my pleasure to introduce Claire Melia, who's currently a research assistant at Middlesex. She's going to talk about contemporary discursive constructions of alcohol use, and she's using data from her PhD research. She's finished it and she's just waiting to hear the results. I'm sure they'll be positive. Claire's research borders social and health psychology, and it has a focus on how research can be used to inform effective policy and guidance for people. She works predominantly with qualitative methods, and she has a particular interest in language and social interaction, and using discursive psychology and conversation analysis methods. I'm looking forward to hearing what she has to say very much. In the course of Claire's talk, you will be asked to complete a very short anonymous poll, and I hope you'll link in and do that, and then we'll use it at the end. We're also taking questions at the end of the talk. As Christiana said, we can't see people or hear you, there are too many, so if you put your questions into the chat, we'll pick them up at the end and put them to Claire. So there we go. Over to you now, Claire.
Okay, thank you very much, Betsy. I'm going to try and share screen and hope it works. Okay, can everybody see the presentation?
Yes.
Okay, Betsy's nodding, so that's a good start. Okay, so as Betsy very kindly introduced, my name is Claire Melia, and I'm going to talk about my PhD, which is, the official title is Contemporary Discursive Constructions of Alcohol Use. In plain English, that just means, how do we talk about alcohol use? So it's a very broad topic to start with, but I'm going to break it down a little bit. It's not going to stay that broad. So I'm going to go through a little bit about some of the background literature, the research aims, data collection, but try and spend most of the time talking about the analysis, and then a little bit at the end about future directions and potential avenues for further research. So I'm not going to read out all these statistics, but this is basically just to highlight that within the UK, the majority of the population do still drink alcohol to some extent. And although 19% of people describe themselves as non-drinkers, this is on an upwards trend. So it's probably a higher percentage of people now, but it's still the majority of people in the UK do drink alcohol. It's very socially and culturally ingrained in a lot of our activities, whether it's going to the pub after work, drinking on your graduation day. It's just something that the vast majority of people in the UK do. And whilst most people do enjoy alcohol moderately and don't have any problems with alcohol, there are unfortunately some people who do have issues with alcohol. And I've put here problematic in sort of quote marks for two reasons. First of all, what is defined as problematic alcohol use can be difficult to specify. So it might depend on the classification system you're using, your professional opinion, or even your personal opinion. And also whether we use the term problematic alcohol use issues, alcohol use problems, they are also very heavily debated. So I just wanted to put that clarification in there just at the start. But we know that regardless of how you define problematic alcohol use, about 6% of all global deaths per year are due to harmful alcohol use, and treatment engagement rates are still really low. I don't know what's been happening recently around COVID and whether treatment engagement rates have potentially gone up or if they've more likely, unfortunately, gone down. But there is a really big issue with actually engaging people in treatment for alcohol use issues. And it's estimated that less than 1% of people with alcohol dependency access any treatment. So there is a really big problem. And one of the suggested major barriers to this is attitudes. And there's two suggestions for this. One is that people have a low perception of needing any help. So they don't recognize that they might have an issue or that they might benefit from any kind of help or treatment. And also a lot of stigma. So whether this is stigma from themselves or stigma from other people, it does stop people from accessing treatment a lot of the time, which does then coalesce with the low treatment engagement rates. And as soon as we start to talk about stigma, I personally start to think about language, because that is my background in social interaction and language. Alcohol and language is really interesting because at the most basic fundamental language level, we use language to share perspectives. Language is how we learn things, we share opinions, we share perspectives. I'm using language right now in this presentation to talk to you and share my research and knowledge. And I'm also using language just on the presentation slides itself. So it is really, really important. It's in everything that we do. It's how we shape our opinions and thoughts about things. And when it comes to alcohol, we do have a professional vocabulary or a professional language which is used to shape medical judgments. And this can be things such as diagnostic terms, which again is debatable. Some people are a big fan of diagnoses, other people want us to move away from them. But we do have a professional language which is operational and which is used for a particular purpose. But often these terms then get used by the general public and start to convey social norms and attitudes instead of what they originally designed to do. So if we think of the term alcoholism, that used to be a professional diagnostic term, but now has very negative connotations, and the field has moved away from that. And as a result, researchers, clinicians, and lots of different organisations have started to advocate that we need to think about our language. And whether this is specifically saying we need to change our language or just saying we need to be aware of it, there's so much research now which shows that our language can have a direct impact on bias and perpetuating stigma. And it's really important to think about the way that we talk about sensitive issues such as alcohol. So I think it's really important to understand the discourses that we use when we discuss alcohol use. How do we talk about it? And what impact can that have? So that is sort of the general overview of the research aims. So as I said earlier, alcohol use is very socially ingrained in the UK. And to drink alcohol and have a problem with it is almost breaching the social norm because it's not what the majority of people do. And this is partially why there's such a stigma around it. And as a result, people have to explain alcohol use problems. Why is it that some people can drink moderately and other people can't? And the perspectives and views that we have are societally constructed. So it's relevant to look at how we talk about it in society to understand how people are thinking about this and the impact that can have on stigma and helping people to access treatment. So the general research question is, what are the prominent discourses available across UK society to account for alcohol use problems? And I'm taking a critical discursive psychology approach, which allows us to take into account not just the language that is used, but also the context of who said it. Because lots of different people have an opinion on language and everyone has a different agenda and different experience. So this approach allows us to look at all of that and take it into account. So whilst that is the general overview of the PhD, I'm just going to talk about the first study today because I could literally talk about this for hours and I have 30 minutes. So the first study I'm going to talk about is accounting for alcohol use online. And we know that up to 80% of British and US adults use the internet for health advice. And that includes whether or not they should go and seek professional help, whether they should see a GP or go to A&E. And this research is from quite a while ago now, so those rates have probably only gone up. And we know that the internet is a really key source of health advice. We also know that it's a really key source for particularly sensitive issues. Especially with alcohol, we know there's that stigma, and that having that discussion with a healthcare practitioner can be really daunting when you're talking to someone and trying to decide, do I need help? Do I have an issue? That can be a really difficult conversation to have. So if you go online, you don't have to have that conversation with the person in front of you. It can make it that little bit easier. So online settings are becoming increasingly popular for information about particularly sensitive issues such as alcohol. However, the internet is very open source. So the vast majority of the population can post on the internet, whether they are professionals, general public, whether they have real issues with people who have alcohol use issues, or whether they are an advocate or a peer. So there are concerns about the accuracy and quality of information online. And we also know that when people go online for health information, they don't just necessarily go to professional sources. They might go to professional sources, but they also might go to peer support forums. So we need to know, what are people saying across a broad range of contexts? What information are people being exposed to? And what perspectives are they seeing? And how can this impact how they think about other people's alcohol use and their own? So to do that, I collected data across both professional sources and general public sources. In total, I had about 550 pages of data collected between 2013 and 2017. 2013 to coincide with the latest publication of the DSM-5, and 2017 just because that's the year I collected the data. There's no further logical explanation for that. So for professional sources, we first had journal articles. So these are things written by researchers and academics for other researchers and professionals such as healthcare practitioners. Policies, which obviously regulate the care that we can provide to people, and the government policies as well. And also newspaper articles, which might not be a professional source in and of itself, but it does filter down some of these professional perspectives to the general public. And that in itself, I think, is a really interesting boundary there between, are they professional or are they general public, and how do they portray this information? So for the newspapers, I took these articles from 3 different newspapers: the Daily Mail, the Independent and the Guardian, so across 3 different political leanings, so left, centre and right leaning. And for the general public, I had alcohol use recovery blogs, and these people were specifically asked for their consent to use their blog post. So they are aware of this, and all pseudonyms are used in this presentation. Also used Twitter and the newspaper comments that were attached to the online newspaper articles I collected. So across there, we have a really broad range of contexts, which is completely on purpose. So I wanted to see, how do people talk about alcohol use from all of these different backgrounds and people with different potential agendas. So before we go into the analysis and the results, I've been asked to do a poll. And the question is deliberately a bit provocative. And I want you to answer, who or what do you think is responsible for alcohol use problems? And you will notice on the poll that there are only 3 options, because I'm going to talk about 3 discourses. So I'm aware that you might not necessarily choose these options, and this is anonymous, so I won't know which one you've picked. Okay, I think most people have put an answer, or they're still thinking about it. But we will come back to the results of this at the end of the presentation, while everyone's having a chance to think about questions to ask. So I'm going to carry on going through. And the first thing I want to talk about is moderation. And I'll just start with a quote. So in moderation, alcohol consumption can have a positive impact on adults' well-being. The majority of people who drink do so in an entirely responsible way, but too many people still drink alcohol to excess. Now that is from the UK government alcohol strategy, and that's from either page 3 or the forward. It's very, very early on that the government says that alcohol is quite a positive aspect of society. I think it goes on a little bit later on the page as well to say that it's a key fabric of our neighbourhoods. And it's this really strong sense that alcohol is important to our society, but only moderate alcohol use. And this was consistent across all of the data. Alcohol in moderation came up again and again and again as something that is completely normal, it's unproblematic, it's just something that we do within our society. And that is backed up by the statistics we saw at the start of this presentation. But what I thought was really interesting is not this notion of moderation, but the fact that it came up in each of the 3 discourses I'm about to talk about, but it was used in a different way. So I will come back to this in each of the discourses, but moderation kept coming up as part of the argument why different people or different things should be blamed for alcohol use issues. So the 3 I'm going to talk about now, they provide an explanation, an excuse, or a justification behind alcohol use problems. So the first one I want to talk about is individual responsibility. And there's 2 strands to this. The first strand is rationality. I'm just going to go through the quotes and then I'll do a bit of the analysis around it. So obtaining knowledge about alcohol helps people better understand what it is they are drinking, the amount it drinks, and understanding these effects is critical in assisting people to reflect on their drinking and make informed choices. The problem is that people ignore these fake limits because they are so very low. Being in possession of the real facts and the real limits, perhaps a grown responsible adult might actually limit themselves. And if the government wants people to take guidance seriously, that needs to present people with realistic advice, which they can use to judge their own risk when it comes to drinking. And it's this idea that we are rational human beings. Because we are rational, if you give us all this information, we can weigh up that information, the pros and the cons, and make an informed choice. We can decide for ourselves how much we should drink. And it keeps saying responsible drinking. And it's not said here in the quotes, but I have it in other quotes that responsible drinking essentially equates to moderation. If you're not drinking moderately, it's considered to be irresponsible and irrational, and just doesn't really make sense why you would do it. So it is this idea that we are rational and therefore we can make our own choices. And because we can do that, we are also held accountable for them. So if you think you have a problem with alcohol, here's a thought and a simple solution. Don't drink. Try taking personal responsibility for your actions instead of expecting the state to pick up after you. We're supposed to be living in times of austerity, and the government is spending tens of millions of pounds on a nanny state. We live in a free society, and it's up to people to decide if to drink, when, and how often. And there are 2 primary choices in life. Addiction is a choice, not a disease. It is very, very clear in these extracts that people are held accountable for their own decisions, whether that decision is drinking moderately or whether they have an alcohol use problem. People are constructed as being responsible for that and having made the choice to drink to that extent. And particularly with the Daily Mail, this idea of nanny state, out of the 15 Daily Mail articles that came up in, I think it was 4 of them, which is quite a lot for such a small sample of articles, that they kept going back to this idea of a nanny state, and we can make our own decisions, we are rational, we are responsible, we take accountability for that. And when you put these 2 things together, this discourse provided an account, it provided an explanation for alcohol use issues, but there was no attempt to mitigate any blame towards individuals. Instead, it presented people as being personally responsible. Many people in society make the choice to drink moderately, so you must have made the active choice to drink this much and develop a problem with alcohol. And this most closely reflected the moral weakness model, which has been widely criticised for increasing stigma. We know that it's not particularly kind to people with alcohol use issues, and it's not really a great way to portray it. I know that's not an unbiased answer, but that's my feeling on it. And one thing that was really interesting was that this discourse was most prevalent across the more right-leaning papers, such as the Daily Mail, and also from the general public when they were discussing other people's alcohol use. It was not seen once in a general public comment where someone was discussing their own alcohol use problems. They might say about how they personally drink moderately, but as a way to sort of go, oh, well, I drink moderately, so I'm responsible and okay. Those other people with a problem are irresponsible. There was this othering going on, this us and them. And it really portrayed people with alcohol use problems in a really negative light. But also because they didn't have a problem, they didn't have any vested interest in portraying it in a more sympathetic or positive light. The second discourse was culture and policy. And the first part of this is this idea of cultural normalization. So moderation comes into it again here. The main problem is the really high relapse rate after treatment. People can successfully quit using while they're being monitored in hospital, but when they return home, they're exposed to those environmental triggers again. My counsellor does not want me at any family functions where booze will be served during the holidays. I've had a rough year. I've had to make some major life decisions and changes. Can't I just enjoy Christmas with my family? And for students, alcohol can be as much a part of university life as lectures. Much of student culture is associated with heavy drinking, right up to a celebratory beverage on graduation day. We've seen throughout that moderation of alcohol use is really popular within UK society. And in the previous discourse, it was seen as quite a good thing. You know, lots of people enjoy it, there's no problem with it. Here it's constructed as quite negative. The fact that moderate alcohol use is so culturally ingrained makes it really difficult for people to not drink. It's almost as if the environment is not supporting people to make that choice. And so it's quite understandable how people might relapse when there's constant temptation around them. Especially the blog from Tracy. She's had a difficult year, but because alcohol is so heavily ingrained, she's being told that she shouldn't spend Christmas with her family because she has to actively try to avoid it. So it really does paint this cultural normalization of alcohol as a real negative. But intertwined with the culture of alcohol use is also policy. So I won't read out all this quote because it's very long, but essentially, public health strategies provide essential measures to prevent easy access to alcohol by vulnerable and high-risk groups. So the accessibility and the fact that it's so easy to get hold of alcohol is part of the problem. And actually, the availability of alcohol can also have an influence on the social availability of it and social attitudes. And the World Health Organization even says here, the cultural norms that promotes harmful alcohol use. So the fact that it is so easily accessible means people can physically get hold of it, but culturally, it's also much more acceptable. And again, here, students are redefining university and shaming authorities that should have stepped in. Laws against smoking have irreversibly shifted attitudes, and the same drive is needed for alcohol consumption. Again, it's this idea that policy is too relaxed at the moment. It needs to be stricter so that it's not as easy to get alcohol and it's not as culturally accepted to drink alcohol so much as well. And again, when we put these two together, this one is a little bit more sympathetic. It provides a justification for alcohol use issues. So to some extent, individuals do have responsibility for their decision of whether or not to drink alcohol. But the cultural environment and how normalized alcohol use is encourages drinking. So it's understandable that they may not always make the choice to not drink because it's constantly around them. And additionally, it's partially the responsibility of public health bodies to provide the environment that encourages people to make what is considered the responsible decision to moderate their alcohol use or to not drink if they've got a problem with alcohol. And many of these sources were left-leaning or centre-leaning. Basically, this was not seen in the Daily Mail. The Daily Mail did not try to diminish any blame towards individuals. And it was also seen in professional bodies who seem to identify with this idea that public health and the government do have some responsibility for this. and for shifting the cultural normalization of alcohol use through the use of policy. And then the final discourse I want to talk about is medical disorder. The first part of this was really quite obvious. It was literally people describing addiction or alcohol use issues as a disorder or an illness and using very medical terminology. So the first extract is very clinical from a journal article and says that alcohol use disorder is a chronic heritable brain disorder. Complex interactions between environmental and biological factors resulting in several underlying pathophysiological mechanisms. That's very, very clinical and specifically calls it a disorder. And then we also see from more general public sources, I was addicted to alcohol from the first drink I ever had. If I had no disease, why is that? What causes some to become addicted if not a disease? And it doesn't make sense unless you accept that addiction is an illness. Otherwise, you think, hang on a minute, why do you do that? And what I find really interesting in some of these extracts is that they draw upon this notion of rationality that we saw in the first discourse of individual responsibility. Their rationality was used to say, well, we're all rational people, so we're responsible for our own decisions. Here, this notion of rationality was used to say, yes, we're rational human beings, so why would we logically choose to have an alcohol use problem? It's not a good situation. Nobody wants to have that issue. It doesn't make sense. And I find it really interesting how the same idea can be used in different ways to further different arguments. And this is a really good example of how they did that. And the second part of this also relates to this idea of rationality. Yes, if we were rational, we wouldn't choose to have an alcohol use problem. But there's this idea of loss of control. We don't have control over this. So addiction is defined as losing control over your behavior and taking or using something to the point where it is debilitating and harmful. You have the sense that human capacity for self-control is sometimes superseded by the craving of choice. And I was done feeling bad for being unable to control something I would never be able to control, no matter how hard I tried. Again, it's really clear that as much as people might try to not drink alcohol, sometimes the choice isn't there. And there is this idea of loss of control. So a rational person would not continue to engage in a behavior that is debilitating and harmful through choice. There must be a reason. And here the reason is portrayed as being loss of control. And again, with this discourse, blame is attributed in a different way. So this one provides an excuse, and I use that in the discursive sense, in that it denies personal responsibility for the behavior. So rather than the person being seen as having made an active choice to have a problem, as we've seen in some of the other discourses, actually it's this idea of lack of control because it's a medical concern. So if we think more recently, you wouldn't see someone who has COVID-19 and say that was their choice because it's a medical concern. They couldn't help that. It's not within their control. And this most closely reflects the biological or the disease model, which supposedly should reduce stigma, but whether or not it does that effectively is debatable. And I know there's quite a lot of papers coming out at the moment suggesting that actually it's not helpful in reducing stigma. And if we think of quite a few medical disorders, such as HIV and mental illnesses, they are medical concerns, but they still have a large amount of stigma around them. Also, you have the secondary portrayal of lacking control, which, yes, if you don't have control over something, can you be blamed for it? Okay, no, you can't. But at the same time, you don't have control. It then portrays individuals as a victim and can lead to disempowerment and stigma in a different way. So I think this is one of the areas where we say, yes, this is how we're going to change language and look at things, and it's going to help and reduce stigma, but does it? I think we need to look a little bit more into this and carefully at actually what is the impact of the different ways that we talk and think about things. And this discourse in particular was seen in public health focused documents, left-leaning, or those people who had their own experience with alcohol use problems. So this was really commonly seen where people were talking about their own experiences and saying, I tried not to, but I just couldn't. I didn't have control of this. There was another extract, which isn't in this presentation, which is talking about how they would love to moderate their drinking. If they could, then they would. And they even said that they should, which again shows how culturally ingrained it is, but that they've tried and they just can't. And these people had more of a vested interest in portraying alcohol use problems in a sympathetic light, but this was also seen by the public health bodies as well. So just in summary of those findings, there were a range of ways that alcohol use problems were explained and accounted for, with different levels of blame attributed to individuals and also organisations. These differed based on the source, so the more negative discourses tended to be more right-leaning at talking about others' alcohol use and not their own, whereas the more sympathetic discourses were seen in left-leaning public health organisations and people discussing their own personal experiences with alcohol use. And again, this idea of cultural normalisation of moderate alcohol use was consistently drawn upon, but in very different ways. So an individual responsibility, this was seen as a reason why individuals were to blame. It was very much a case of, well, the majority of us can drink with no problem, absolutely moderately, so it must be a problem with you. Alternatively, the medical disorder and culture and policy discourses drew upon normalisation as a reason why individuals shouldn't be to blame. So culture and policy saw it as a case of, people are surrounded by alcohol use constantly. It's understandable that sometimes they may not make the decision that they originally were trying to, which is not to drink. And with medical disorder, it was seen as loads of people drink moderately. So if some people can't, there must be a reason for that, and that must be a medical reason. So I also want to point out that these discourses are a lot more nuanced than I've presented here. Obviously, there is a time limit, but there are a lot more nuances in these discourses, and it's really interesting to see, even just within this sort of overview, the amount of different things that you can really quickly pick up on these discourses. So then it's worth thinking about, well, what do we do with this research? So the next part of my PhD, the second and third studies looked at how do individuals justify their own alcohol consumption within interactional settings. So when you're looking at online data, people have the option to be anonymous. It's also shown that people tend to be a bit more provocative sometimes with their views. And you can kind of say what you want and relatively get away with it. That's a bit harder to do when you've got people right in front of you. When you've got someone in front of you, how do you talk about alcohol use then? And how does that change the different things that you might say and how you might talk about it? And I don't want to say too much because who knows, maybe one day I'll come back and finish off the rest of this PhD in a talk here. And then other avenues of research. I'm really, really interested in how these discussions happen in clinical settings. So I've seen how they happen online. The other part of my PhD looked at how they happen in person, just general interactional chat settings. But what I don't know is, how do clinical encounters go? So we know that these discussions are really difficult to have, but how do people have these discussions with their healthcare practitioner? And how can we look at different ways of framing things that doesn't immediately make people be defensive or helps them to see that maybe they do have a problem? How can we help make these conversations better? And it will surprise absolutely no one that I'm also quite interested in COVID, because everyone is interested in COVID, including me. And I want to look at certain behaviours. So previously, drinking at home or drinking in the park were not particularly seen in a positive light. They were probably seen as a bit worrying and a bit problematic. But now that's really common. It's almost become socially acceptable because of COVID that you drink at home or in the park, or you get a takeaway pint. And I'm interested to see, how does the media portray this and how did it used to portray it? So how has that changed? and how has it now become more socially acceptable? So that is my current research, where I might want to go in the future. And now it's time for you to ask me some questions.
Thank you very much, Claire. That was a fascinating talk, and it raised lots and lots of interesting points about how these different discourses explain alcohol problems and then attribute blame to various sources and different causes. I do wonder, though, what the poll told us. So should we have a look at that before we, and while people can put some questions on the question and answer thing. So looking at the poll, we found that most people, 69%, felt that culture and alcohol policy were responsible for problems. That was followed by individual responsibility, ticked by 37%, and medical disorder was the lowest with 18%. Now, it's anonymous, but I do wonder if it might sort of reflect the audience, and the medical people might have ticked medical, and the social scientists such as us might have ticked something else. But anyway, it's interesting to see that culture and alcohol policy came near the top. I don't know if you want to reflect on that, and then we'll get on to the questions.
Yeah, I think culture and alcohol policy being the top doesn't surprise me. I think from a lot of people that I've spoken to, and I know some of them are already in the audience, I know that. Yeah, there's a lot of people who do think that alcohol policy could do more, and it is that interplay between culture and the policy, and it's all a bit of a mess at the moment, and it needs disentangling a little bit. What I am surprised about is that individual responsibility is as high as it is. So I don't know if anyone that ticked that one would like to say anything about that. But yeah, so a bit of a surprise and also a bit of a not surprise in there.
Thanks, Claire. Well, we do have some questions up already, and please keep them coming. Put them in the Q&A box, and I'll try and go through them. We've got a couple that I think are on the biological side. I'll come to the second one of them in a minute, but the first one is from Serge M. And the question is, but what about the genetic predisposition of those with the gene code DRD2 A1 ALL-ELE? Doesn't that answer and qualify the concern that alcohol use disorder as a medical disorder? In other words, asking, does it not justify seeing it as a medical disorder?
So I think the important thing to point out with this research is that I am not trying to find out what is the cause of alcohol use. I'm trying to find out what are other people saying, how do other people portray it? And it just very neatly sort of fell into these preconceived theories. I actually tried to go into this not knowing too much about the different theories because I didn't want to bias myself. And yeah, this is just sort of the ways that people were constructing this, and medical disorder was a very clear one. And I think people who think that way would definitely draw on things like that to say, well, there's a gene that has been shown to have an impact here, and would definitely use that as part of their argument as to why that would be the key cause for alcohol concerns.
Yeah, thank you. The other one, which is related, I think, to the biological, and you've answered it really, because you said you were not looking at that. You're looking at how people talk about it. But Dr. Kamal Banik said, kindly in details, Wilson disease. I'm not quite sure what the question is, but I think that if anyone can answer that, then please put it in the Q&A or in the chat, and we can come back to it. Rebecca Askew has asked, have you reflected on gender within the frameworks you've presented?
Gender wasn't collected as in information about that, unfortunately, especially with the online sources. So if you think of a lot of the professional sources, the policy documents and the journal articles, there's multiple people involved. It's not just one person putting forward that document. And then in some of the general public things, so the tweets and the newspaper comments, I mean, some people might have had names where you could probably tell what their pronouns were, but not everybody did. So unfortunately, in this situation, there just wasn't a way to accurately get that information.
Thanks, Claire. I'm going to follow with a question from Karen Duke because it follows on very neatly from the last one. Karen says, thanks for your excellent presentation, Claire. Following on from Rebecca's question, what about other demographics like age, ethnicity, sexuality, religion, etc.? How do these variables affect the discourses surrounding alcohol?
Yes, so that's not something I've directly looked into myself, but I think that is a very valid question. There is an entire section of my thesis which sort of goes, I just looked at the UK. This could be very different. I remember actually in the second and third studies, I did a World Cafe, and there was someone there who, they did not tell us what their religion was, but they actively did not say anything on the dictaphones, and they went along because it was training for the department, but they didn't want to be involved in the discussion really. They were just there to hear. And my understanding is that they did not have a Christian religion, and I do wonder how that would have affected their views on things, because different religions, alcohol is not as accepted as it is in UK culture. So I think that is a very valid question, and it's something I've raised myself as something that I think I need to look more into as well.
Your future career will be spent doing that. A question from Polly Radcliffe, who's just wondering about a rather neglected area of research. What about the pleasures surrounding alcohol? Were drinking stories part of the discourses you analysed?
So there were a few people that spoke about the positives, but this was mainly people who were talking about how, you know, I drink moderately, so there's nothing wrong with me. What's wrong with you? But there were people who were talking about how positive alcohol can be. We even saw it in the UK government alcohol strategy. And I think there is definitely an understanding that alcohol does have its place. It can be positive and it can facilitate social relationships and things like that. But it didn't come up too often in my research. It mainly just come up in when people were justifying moderation, but it did come up a little bit more in studies 2 and 3. So that's a little teaser about that part of the PhD.
We look forward to reading more about that. A question from Katie Anderson. How could government and health organisations change the way we talk about problematic alcohol use to promote more moderate use? And she also thanks you for your interesting talk.
So again, that relates to the second and third studies of the PhD, but I will answer more about this question. And I found in the second and third parts that regardless of how you talk, how you drink alcohol, you make an effort to justify your consumption. So whether you drink quite heavy, whether you drink nothing at all, people would justify it. And especially the people that did drink quite a bit of alcohol use, they would use quite a lot of different discourses. So they might say, oh, well, I still got up in the morning and managed to go to work. Oh, well, I'd never drink if I had to look after my kids, but I didn't have to do that. And it's this idea that, yes, we have the guidelines, but actually people don't judge their own drinking on the guidelines. And it's something I'm trying to look into now and think, okay, how can I make my research more applied and useful in that sort of vein of research? And I think that the government and public health bodies, they need to know how the general public understand alcohol use and what is socially acceptable. And by doing that, they can tap into that language and tap into the justifications that other people draw on and try and use that to adapt the messaging. I'm not 100% sure how yet, but it's something I want to work on more.
Got a lot of work to do. James is asking you, did you find anything about discourses around parental alcohol use?
So again, not in this part of the study, it didn't come up, but in the second and third parts, it definitely came up quite a bit. So in people who were drinking quite a bit, again, they would say, well, if my kids were around, then obviously it wouldn't because I've got the responsibilities. So they use their parental responsibility as a way to portray themselves as, I'm still a responsible citizen, but when I don't have to be really responsible, I can drink a bit more. And then people who didn't drink very much often drew on external justifications, such as, I need to look after the children. What if there was an accident? I'd need to be able to drive them to hospital at night. So that definitely came up a lot more in the justification discourses about their own drinking.
I think you've touched a bit on the next question from Joan. Joan says, interesting presentation, Claire. I am interested in discourse amongst people themselves who use alcohol. Does this influence how people perceive their own use and problematic use?
So what I was interested in with the second and third studies, originally I just wanted to see, how do people talk about alcohol use when they're in that interactional setting? Not once did I ask anyone about their own alcohol use, but there were 58 occasions where people just offered information about it. And I think every single time they offered information, it also came with a justification of why it's socially acceptable. And particularly for the people who drank regularly and/or heavily, they constructed the boundary of what's socially acceptable alcohol use as part of their justification. And they were very, very careful to make sure that they were on the safe and correct and acceptable side of that boundary compared to other people who were not. So I do think it has an interplay between how people then construct what they think is acceptable or isn't in relation to their own use.
Yeah. Okay, thank you. A question from Suzanne McGregor and a comment. She says, right-wing people who generally prefer individual responsibility as the explanation seem often to change their views when someone in their family has a problem, especially a child or maybe brother. Did you come across examples of how discourses changed in the light of experience?
I don't remember coming across anything where they specifically said, I used to think this way, but I had this experience and now I think that way. I think there might have been a couple of examples where people said, yes, there were a few examples where people said, I have family members who have drank this way, and such, and they seem to have more of a sympathetic view. And it also came up in the third study of the PhD, which was around people who don't drink. And quite a few of those people drew on negative experiences, such as having family members. And I have a really, really nice extract where there's two people in a group who both have experience with family members who have had alcohol use problems. And they've said how that's affected how they drink. And now they don't drink at all. And it's really impacted the way they view it. So not completely what you were asking, but related.
Yeah, common. Okay, James Morris has answered something, the earlier question from Serge, but it's in here. And James says, genetic predispositions may contribute to AUD, but it's an overly reductionist model, hence attempts to integrate the also established psychosocial factors via a biopsychosocial model, which James mentions is still imperfect, but accounts for the range of factors that go beyond genes. So, and I think that's correct. There has been a movement, and your discourses have actually displayed that, away from the purely biological explanations towards a biopsychosocial range of explanations. So that's quite interesting. Thank you, James. Emma has said, hello, Claire. Thank you for your lovely presentation. What's your opinion on abolishing qualifications of alcohol consumption, moderate, excessive, and orienting people to reflect on their personal goals regarding their consumption as a way to decrease public and internalized stigma?
You've not gone for the easy questions here.
No, they're not easy.
Oh, this is something that I'm sort of struggling with myself. So in my thesis, I kind of come to the conclusion that people do not listen to the unit guidelines. What can we do to make policy effective for lots of people? I think, because on the one hand, you can say, yes, it's very individualized. And I found that with my data that people, they really bent the rules as much as they possibly could to justify how their alcohol use was justified and acceptable. And I understand that people are going to do that. It is a very, very individualized behavior, and it's very morally bound, both personally and societally. But on the other hand, I feel like we have to have something operational in place, something that's going to cut across different experiences and genders and ages and tolerance levels even. But I don't know where the boundary for that is. I think there needs to be a compromise somehow between the two, but I just haven't figured out yet how far on either side of the line I think would be useful, or how we would do it. So that's kind of a non-answer, I'm sorry.
No, not easy to answer, yeah. The next question is from Colleen Simon. I wonder whether drinking culture has changed across generations. For example, older people's attitudes to alcohol in comparison to young people, potentially being more health conscious and better informed regarding their impact on health.
Yes. So statistically, I'm sure someone will correct me if I get this completely wrong, but I think the rates of non-drinkers are primarily within university age and younger adults. So I think around 18 to 25, don't quote me on that.
Yeah.
Whereas actually more of a concern at the moment are middle-aged and older age drinkers who were drinking more, and as they've got older have just kept that trend of drinking, whereas it's the younger generation that are drinking less. So I think culture is definitely changing. I mean, I've heard anecdotally there's a lot of people say, oh, my parents drink a lot, so I don't want to, and people trying to do the opposite of their parents. I mean, there's lots of research at the moment trying to figure out why there's this change, and is it because they are more health conscious? And I think that's definitely a really interesting area of research that's getting a lot more traction now. So I don't have the answers necessarily, but I would definitely suggest looking into that area, because I think it might hold some answers that you're looking for.
Yeah, generational change is certainly interesting, and it's not new. We've heard about long waves before of up and down, but that's good. We've got two more questions, and I think that will bring us nicely up to time. James Morris has said, great talk, Claire. Do you think shifts in media representations would be the quickest way to change or improve discourses and stigma?
James already knows my views on this.
He wants us to know as well.
Well, I don't know if it's the quickest way, but I think in the short term, it is probably the quickest way, actually. I don't know if long term it would hold up. So I'm thinking more recently, I mean, me and James have both written a paper together about Adrian Charles's documentary. And I think there's been recent research showing that after Adrian Charles's documentary, there was quite a large uptake in people downloading, I can't remember which specific app it was now, but some of the apps where you can track your drinking and they can tell you, do you have a problem? Are you okay? And that uptake was particularly in middle-aged men, I think it was. And it was attributed, and I think it was called the Adrian Charles effect, a bit like how we had the Jade Goody effect with testing for cancer quite a few years ago. And that lasted for quite a while, but it's now dwindling off. And I imagine that the same thing might end up happening with alcohol use. So I think media is a good way to tackle it, but I don't think it would fix everything. I don't think long term that's going to be the thing that makes the change.
Yeah, the search for the Holy Grail. So the last question is from Jordan. Hi, Claire, really interesting. What do you think the alcohol pricing policy, what do you think the effect, I think, is the alcohol pricing policy has had on dependency drinking or alcohol as a whole?
This is an area that I've not delved into too much yet. So it's a bit like how I know about the changing trends in alcohol use with the younger drinkers. I know about it, but it's not been, I've been so sort of tunnel vision focused on this for now, that I don't know that much about it at the moment. But I think the results coming out of Scotland have been good. But I know there have also been concerns about, well, will this make any difference to sort of the middle-aged and drinkers who have the money there? Is this just going to be difficult for the people who can't afford alcohol very much and who might have the most problems and who might be buying the really cheap alcohol like Frosty Jacks and things like that? So I don't know. I definitely think it's a positive idea, and I'd be really interested to look more into the research. And I think it's worth a try at the end of the day.
Yeah, it's very difficult to come up with one answer, isn't it? Yeah. Well, thank you very much. We are at the end of this session. It's been brilliant. It's been an excellent talk and wonderful questions. So thank you everybody who's put up a question and participated in the poll and attended. And there's lots of comments coming up on the chat, so we can look at these later. We'll also be putting the recording up on the Drug and Alcohol Research Centre website, so you will be able to go back and watch again and think about all the things Claire has said if you want to take anything further. So thank you again everybody for coming. I hope you'll join in our future seminars. We've got one coming in March given by James Morris, who's with us today, and I'm looking forward to that. I've forgotten what he's talking about, but I'm sure it'll be brilliant. So thank you, everybody.
Thank you for listening.